Symptoms of Lassa fever. The incubation period of Lassa fever is 2 to 21 days. That's 2 days to 3 weeks. Incubation period means the time from where when you were exposed to the disease up to when symptoms appear. So it can take 2 days for symptoms to appear. It can take 3 weeks or 21 days for symptoms to appear. That's the incubation period. When somebody is symptomatic, again, I will re-emphasize that if 5 people are infected, 4 will show no or mild symptoms. It's only 1 in 5 that gets sick and shows symptoms. Now, when somebody is symptomatic, is showing symptoms, you should note that the onset of the disease is usually gradual. It doesn't hit you once and you know that, oh, I have this. No. The onset is gradual. It first starts with fever, general weakness, headache, malaise, feeling unwell. That's how it starts. After a few days, then the person now develops sore throats. Sore throats. It's important to note that. Muscle pain, chest pain, nausea, feeling like vomiting. Vomiting itself is a symptom. Diarrhea, cough, abdominal pain. This may follow a few days later. Then as the disease progresses, in severe cases, there can be facial swelling. The face starts to swell up. There can be fluid in the lung cavity and the person have difficulty in breathing. The person can be bleeding from the mouth, from the nose, from the vagina or gastrointestinal tracts. Can be bleeding through the anal region, or through the mouth, or bleeding through the gastrointestinal tract into the body. you know. Then low blood pressure may develop, so these things too can occur as the disease become severe. Then also as disease becomes severe, the person may be in shock. There's what we call shock. Just take note of that. Person can have seizures, convulsion, as we saw in the account of Dr. Philip. The elder brother said Dr. Philip from Federal Medical Center Makurdi was having convulsions, had dialysis before he sadly passed in Irwa. Then the tremors, disorientation, mm, and coma may be seen in later stages. It's noted among hospitalized patients on admission, approximately 15% of Lassa fever, approximately 15% die of Lassa fever disease. If in general, the case fatality rates for Lassa fever is 1%, meaning that if 100 people have Lassa fever, one out of that 100 may die from the disease, right? But if somebody is hospitalized, among those who are hospitalized for Lassa fever, 15% die. That's 15 out of 100 patients are hospitalized will die from it. So case fatality rate for hospitalized patients is 15%. In fatal cases, that's in cases that leads to death, death usually occurs within 14 days of symptom onset. During pregnancy, Lassa fever can cause high maternal and fetal mortality. That's death in the mother and death in the baby, especially late in pregnancy. In the third trimester, that's the last 3 months of the pregnancy, fetal death, that's death of the baby in the womb, fetal death rate can exceed 80%. Maternal death rate 30%. So in the third trimester, if a woman gets infected with Lassa fever in the third trimester of pregnancy, the last 3 months, 80% of cases that baby will likely die. and in 30% of cases, that mother will likely die. So there's a high maternal and fetal mortality when Lassa fever affects a pregnant woman. That should be borne in mind. And to remember that a number of these health workers who I talked about, they got the Lassa fever from a pregnant woman. Dr. Salome Oboyi, the one that died, the doctor that died recently at Bingham University Teaching Hospital in Jos, got it after conducting a cesarean section in a woman who had Lassa fever, after performing surgery on a woman with Lassa fever. Dr. Victor Wanto from Dash Hospital in Nasarawa State, they died in a woman who had PPH, postpartum hemorrhage, and she was bleeding. Dr. Victor did uterine artery ligation to stop the bleeding. That didn't work. And Dr. Oga now did hysterectomy, and it was assisted by Dr. Victor. And they got, they didn't know the woman had Lassa fever. They didn't know that the bleeding that was occurring in that pregnant woman who had delivered was as a result of Lassa fever. They didn't know that. They didn't take cognizance of that. And they later became sick and died. And the sample was taken from Dr. Victor after his death, and it was found he had Lassa fever. And then Dr. Olga also died from it. So you should note that Lassa fever is dangerous in pregnant women. It can lead to high mortality in pregnant women, high mortality in the baby, you know, and also it can lead to transmission to doctors, especially obstetricians and gynecology that are treating women that are pregnant. Because this woman that is pregnant that has Lassa fever, when it comes bleeding, the doctors will always think the first training is that this woman is bleeding as a result of the pregnancy. And bleeding in pregnancy is something that occurs and something that can lead to the death of the woman. So these doctors will take steps to save the woman's life, you know. And if there is no high index of suspicion that the woman may have Lassa fever, these doctors could get infected, as it happens with Dr. Salome, as it happened with Dr. Olga and Dr. Victor Owanto. You know, they contracted it and they died. So that point should be borne in mind. So talking about recovery can take a long time. It's called prolonged convalescence. That's taking a long time to recover from the disease. And sometimes it can lead to other conditions. The disease, Lassa fever, can lead to other conditions, what we call sequelae. Sudden hearing loss has been reported with varying incidence, and up to 25% of recovered patients, both during the acute disease and recovery. So in up to 25% of patients, 1 in 5 patients that recover from the disease, they can develop sudden hearing loss, either in the acute phase or in the recovery phase. They can develop sudden hearing loss, you know. So sudden hearing loss is a complication, something that is seen in patients that develop Lassa fever. In most circumstances, hearing loss is reported to be permanent. That hearing loss can be permanent. Some can recover some hearing after some months, like 3 months. African CDC says that deafness occurs in 25% of patients who survive the Lassa fever disease. In half of these cases, hearing loss returns partially after 1 to 3 months. The US CDC says Lassa fever can lead to hearing loss, with about 1 out of 3 cases experiencing various levels of deafness. Deafness can occur in both mild and severe cases of Lassa fever. In many cases, the hearing loss is permanent. So different sources, pointing to the fact that hearing loss can be a something that is seen in Lassa fever. Other sequelae, other things that can result from Lassa fever, you can have neurological signs, you can have visual impairment, you can have joint pain, it can lead to transient hair loss, psychological disorders. These have been reported. They are not as common as the hearing loss. Hearing loss is as a result of one, the virus, affecting the structures of the inner ear and the nerve, you know, that helps to conduct signals that can help us perceive hearing. Then it can also stimulate an immune reaction, inflammatory process, and immune reaction stimulated by the virus, and that immune reaction or inflammatory process can damage the structures in the inner ear and the nerve, you know, that's responsible for hearing, conducting signals to the brain. So when there is damage to that structures, it could lead to what we call sensorineural hearing loss. As we've seen, the hearing loss can be permanent. Some can have some recovery after some months. So as a result of all this, patients who have recovered from Lassa fever to receive care for sequelae they may experience. So somebody that has recovered should there's a certain follow-up timeline, person coming for follow-up to check for these things that can result from Lassa fever. For diagnosis of Lassa fever, it can be difficult to clinically distinguish Lassa fever from other infectious diseases. So other things that could somebody that has malaria, the symptoms of Lassa fever can be difficult to distinguish clinically, except you do test. It's difficult to distinguish the early stages of Lassa fever symptoms from things like malaria, typhoid fever, shigellosis, what usually cause Shigella dysentery with blood in the urine, yellow fever, other viral hemorrhagic fevers like Ebola. you know. So these things, when somebody has Lassa fever symptoms, early symptoms, you could think the person has malaria or typhoid fever or shigellosis or yellow fever or other viral hemorrhagic illness like Ebola. So that is the difficulty. The person is the symptoms the Lassa fever patient present with is not unique to the disease, and so you could easily mistake it for other things. That is how easy it is for health workers to get it, because you'll be suspecting other things, and all these other things are more common. Malaria, typhoid fever, shigellosis, they are more common than Lassa fever. So the doctors are right to think of all these things, but should bear in mind during the season, the peak season of Lassa fever is during the dry seasons, the towards the end of dry season, March, January to March. That's the peak season, and this period we've seen the death of Dr. Salome in Jos, other another doctor hospitalized, you know. So this that should be noted. Confirmation that symptoms are caused by Lassa fever infections are made using the following diagnostic methods. To confirm that the patient has Lassa fever, samples have to be taken and tests conducted. You have the reverse transcriptase, polymerase chain reaction, RT-PCR assay. You have ELISA, antibody enzyme linked immunosorbent assay. You have antigen detection test. I have virus isolation by cell culture. So if you suspect Lassa fever, there are those who are trained to collect the samples, and there are proper ways the samples can be secured so that there's no other people are not at risk. And there are centers in Nigeria, good enough to have more centers now, as a result of COVID. I have more centers where some of these tests can be done, unlike before. I have more treatment centers now, unlike before when people have to go to IRWA. You have more treatment centers available and all that. So these tests can be done, but you need to suspect, and you have to have your suspicion radar high on alert, especially if you are taking care of in patients on admission. Mm. If you are treating patients on admission, we've seen doctors get it from children, you know, Dr. Shizaram, you know, Dr. Victor Idowu in Kogi State. They got it from less than 1 month old, less than 1 year old babies. If you are managing patients in the ward, if you are in obstetrics and gynecology treating pregnant women and some with bleeding, if you are conducting surgeries on patients, you know, coming with bleeding, all the, you now have to have high suspicion to now know that, oh, I should consider Lassa fever as one of the things that could be responsible for what the patient has. Especially a patient dies, you know, and the presentation of the patient seems suspect and the patient dies, you know, it should be noted. Like the patient that Olga, Dr. Olga and Dr. Victor Wato operated on in Dash in Lafia in Nasarawa State. The patient died, after all they did in hysterectomy and all that, and then um they became developed symptoms later. So if a patient you are treating a patient presented with bleeding and the patient died, and there are no things to justify such an outcome, you know, you should also consider that you carried out surgery on a patient died, and you are now having symptoms, fever and all that. You should also think about this. It's important to note that there is a drug that is being given, even though the ribavirin. mm, so it should be noted that that drug is available, but it needs to be started within 6 days of developing symptoms for it to have any effects on the disease. You know. So you need a higher index of suspicion to now note that, okay, I should think of this. Samples should be collected from the dead subject, and then to take prophylaxis, to prevent the disease from becoming something serious in that individual who is exposed.